This is the JTV Caribbean News. I am Sean Rose. St. Lucia's Ministry of Health held a consultation recently with the St. Lucia Tourist Board, the Ministry of Tourism, and the St. Lucia Hotel and Tourism Association in light of the threat posed by Zika to that country and the entire Caribbean region. The officials discussed their action plan to protect the citizenry and guests to St. Lucia against the debilitating disease. More in this report from HTS News Force.
On January 26th, the Center for Disease Control stepped up the travel notices for people heading to destinations with the Zika virus from green, which advises the practice of usual precautions, to yellow, practice enhanced precautions. Since the first local transmission in May 2015, Zika virus has spread rapidly to 22 countries. Experts contend the Zika virus will inevitably spread to every single country in the Western Hemisphere, where the Aedes aegypti mosquito is populated. Chief Medical Officer at the Ministry of Health, Dr. Merlin Fredericks, says the sit-down with tourism officials was in a bid to allay the concerns of agencies responsible for St. Lucia's mainstay.
Though we have not confirmed Zika in St. Lucia, we do know that it is in nearby countries. We know that it has been confirmed in Martinique, in Barbados, and some other countries in the region. And as such, we are continuing our mode of preparation and enhancing all of what we're doing to ensure that if at any point in time the virus reaches here, the impact will be very much lower than what would happen, if we did nothing at all.
Meanwhile, U.S. scientists say a vaccine for the Zika virus is as many as 10 years away. The Zika virus can be spread from expectant mothers to their offspring and may cause a serious birth defect called microcephaly. The CDC advises pregnant women to consider postponing travel to any area where Zika virus transmission is ongoing and strictly follow steps to prevent mosquito bites during the trip. The fear of Zika virus has prompted several visitor cancellations. Director of Tourism, Louis Lewis, says the consultation with the Health Ministry at this point is imperative.
What is very competent is that there have been known registered cases in St. Lucia, and there are a number of initiatives that are ongoing to prevent an outbreak on the destination, which we are now going to push out to the various partners and the tour operators and through all our media where people are contemplating visiting St. Lucia, that St. Lucia is still a safe destination. We are quite assured and we are confident of some of the initiatives that have been taking place by the Ministry of Health to ensure that we remain a safe destination. And I think that is the greatest benefit that we've had from this meeting here today.
Narani Aziz of the St. Lucia Hotel and Tourism Association says concerns are mounting. He says the SLHTA is grateful to the Ministry of Health for their clarification of the Zika virus.
It is very important that the SLHTA, in collaboration with some of the other stakeholders, particularly the Ministry of Health and a number of communities, to look at what we need to do in order to address the whole issue of guest perception about a safe vacation in St. Lucia. One of the very high priority items for us as well at the SLHTA is the health and safety of our workers within the industry. For many of us, we're aware that tourism accounts for the greatest number of employees within the industry.
And in related news, some airlines, including those serving the Caribbean, have started offering refunds to passengers who had been booked to fly to some of the countries where cases of the Zika virus have been confirmed. United Airlines, American Airlines, and British Airways are allowing passengers to back out of travel. So far, the mosquito-borne virus has surfaced in Barbados, Bolivia, Brazil, Colombia, Ecuador, El Salvador, French Guiana, Guadeloupe, Guatemala, Guyana, Haiti, Honduras, Martinique, Mexico, Paraguay, Panama, Puerto Rico, St. Martin, Suriname, and Venezuela, even though international health authorities have indicated that Zika will likely spread to all countries in the Americas. British Airways said pregnant customers with flights to Sao Paulo and Rio de Janeiro, Brazil, or to Mexico City or Cancun, Mexico, could change their booking free of charge, delay their journey, or choose an alternative destination. American Airlines is offering pregnant passengers a full refund if they provide a doctor's note showing they are unable to fly to El Salvador, Honduras, Panama City, or Guatemala City. Meantime, United Airlines said it is giving customers who are traveling to the affected regions the opportunity to rebook at a later date or receive a full refund. The Caribbean Tourism Organization and the Caribbean Hotel and Tourism Association have said there are already reports of travel cancellations in the Caribbean due to Zika. Tickets booked on regional carrier Liat from March 1, 2016 will be free of any fuel surcharge, a move which Chief Executive Officer David Evans said would see ticket prices drop by about 5%. The decision follows the dip in global oil prices, which recently hit a 12-year low of $28 US per barrel, and Liat said the price drop had ended a decade of high jet fuel cost, which impacted the price of tickets. While the price of oil has been trending downwards for some time, Evans explained that the effects of crude oil price reductions take some time to impact the cost of aviation fuel. The airline CEO said the surge in oil prices since 2003 had turned fuel into one of Liat's largest costs. The departure of 3 members of the Cayman Islands Legislative Assembly from the government backbench could trigger an early general election, says Premier Alden McLaughlin. This, he says, would be conducted under the old multi-member voting system. The Premier says with a very narrow majority, his government may struggle to get through the next 14 months before the anticipated nomination day in March next year, ahead of the May 2017 national poll. Cayman Islands government has a slender majority of 1 member on the floor, as the PPM's 10th member, Juliana O'Connor Connolly, currently occupies the Speaker's chair. McLaughlin also made it clear that if he is forced to call an early election, it will not be under the system of one man, one vote, because the Elections Office has said it needs a year to implement the changes required for a new voting system and the new constituency boundaries, which are considerably different from the previous polling areas. Independent member Ezard Miller has said that he is willing to offer his support to government to ensure a quorum, and he has no desire to see the administration fall before the end of its term, especially if it means early elections without changing the voting system. More local news in just a moment. And coming up next on JTV News. And there has been a recent increase in the number of people affected by gastroenteritis here in BVI. In our Hot Trends segment, Kristen Fraser of Treffle to launch a new line to add to her other internationally recognized sleek designs.